Welcome to the latest podcast from the RCN. I'm Harriet Anderson. This week we're talking about mental health care in the criminal justice system. Joining us in our discussion are Professor Lewis Appleby, National Clinical Director for Health and Criminal Justice and Professor of Psychiatry at the University of Manchester. In his new post, which he took up in April 2010, he aims to improve the healthcare of offenders and in particular reduce the number of mentally ill people in prison. Callum Meiklejohn has been an RMN since 1985 and has worked as a clinician and manager in secure mental health services. He's been the chair of the RCN Nursing and Criminal Justice Forum, and this year he won the coveted Nursing Standard Award for Nursing Innovation in Criminal Justice Settings. Colin Parrish is editor of two RCN journals, Mental Health Practice and Learning Disability Practice. I'll hand you over to Colin, who will lead the discussion.
Thanks, Harriet, and welcome Lewis and Callum. First of all, Lewis, I'd like to ask you about your early impressions of your post at the department.
Well, being at the department isn't entirely new to me because I've been hanging around it for the last 10 years.
Sure.
But the thing that has struck me most about moving into offender health is how much good work is already happening around the country. And if you consider that I did know a little bit about offender health before I came into this post, and even so, I was surprised by how much good practice, how much expertise there is. What there isn't necessarily is a national coordination of that.
Right.
There isn't necessarily the learning from it, the sort of strategic drive that would turn good local practice into an important national initiative, and that's the bit that we have to achieve.
So it's about making best practice, everyday practice everywhere.
Yes, I mean, if you think about how services change, one of the things they need is evidence of what a good clinical service is.
Sure.
It isn't a matter of opinion. You have to be able to show that your service is delivering what it's intended. You have to be able to show that it does it at the right amount of money. Value for money is absolutely vital now. You have to be able to show that you have the right workforce skills and that you have the right information, the right way of monitoring and feeding back on a system so that it can change in the right direction. And putting all of that together, I think, is the role of a national strategy, and that's now what we have in offender health.
Sure, and presumably nurses are vital to making this happen?
Well, everything we talk about in offender health is really about nursing practice, more than it's about anything else. And there are 10 times as many mental health nurses as there are psychiatrists.
Sure.
Now, I'm a psychiatrist. I don't want to downplay the important role of psychiatrists because it is vital. But in the end, the service will improve because nurses work differently. They acquire the right skills and use those skills in clinical practice.
So, Callum, how are nurses getting involved or continuing to have an impact on people with mental health problems in prison?
Well, I think certainly in some areas, what they are doing is they're providing assessment and referral systems at the courts, the local courts. And as such, if people do move on to the prisons, then hopefully an assessment or mental health information goes with them to the prison mental health team, where there is one. And I think that's vital because, as Professor Appleby said, we do know a lot of the risk factors are around or just after the reception stage at prison. So any information we can get from people who are currently or have known about the care and treatment of individual prisoners to the prison is vital. And I think that's what we call the development of the offender healthcare pathway. And nurses play a vital role in that. Again, along that theme, it's about care coordinators. Now, I view prison as only a temporary change of address.
Right.
Now, whether that's 1 month or 15 years,
Yeah.
it is still a temporary change of address.
So the services should be the same?
Absolutely. So if somebody is known to a service and they're on care coordinator CPA, the care coordinator should remain involved in coordinating that person's care whilst they're in prison, and historically not go, it's a forensic issue now,
Yeah.
because it isn't, and that's quite clearly.
Callum, I know that Lewis came down to see you. What did you think of what you saw down in Bristol?
I thought it was brilliant. It's a great example of what you really become aware of in a job like mine, which is how important that local initiative, that local drive is. And you know, if you're in a local service and you know what's required, I must say my advice is not to wait for the government to tell you how to do it. And I think the government plays a very important part in all of this, of course. But in the end, the point at which delivery of better care happens or doesn't happen is in the front line of services. And no amount of government strategy will make that happen unless you have the right people in local level. And the service in Bristol, the Court Diversion Service, has become quite well known, and deservedly so. because it is providing a model of what could be achieved across the country.
So what do you want nurses to do out there? I assume that there are nurses all around the country working in offender health who've got great ideas and perhaps come up against barriers when they try to implement them. Do you think you could help them out in that situation?
Well, the Department of Health's position should help them, because the department has made offender health a priority. I mean, there is now, if you think of the history of it, Lord Bradley was commissioned to write a report about what was initially referred to as diversion, although he very cleverly interpreted diversion as meaning the entire relationship between the health system, particularly mental health, and offenders. And out of the Bradley report came a government programme, the Health and Criminal Justice Programme, which is national policy. And the new government has come in, it has agreed that the programme is heading in the right direction. Of course, it may want to place its own priorities on that programme, but broadly speaking, it is supportive. And so we expect mental health services nationally, drug services, alcohol services, to be putting into effect what that programme says. And it is at the heart of that programme is diversion. It's taking people out of the criminal justice system when their needs would be better met in mental health care or in healthcare.
Callum, what role does the RCN Forum have in this?
I think the RCN Forum has a role to liaise with strategically Professor Appleby, the Department of Health, and a number of other organisations in providing advice, consulting on behalf of the members of the Royal College and nursing as a workforce. And I think the nurses predominantly need to feel as though they belong to NHS organisations, or NHS organisations need to own them. And historically, the services I've built up and recruited from 2 nurses to near 40 now in the area I work in, the organisation now owns us through a governance point of view, an integrated governance point of view. And I think that's absolutely crucial in taking that agenda in to support the nursing workforce in courts and in prisons. And certainly the biggest recruitment has been in nurses. And so we have a number of nurses who contact the forum, for example, who aren't at that place. They're not owned, they feel marginalised, they feel isolated. And they want advice and support as to how we can help them to feel as though they're working in safe environments. Now, prisons is never going to be a safe environment. It's not an NHS building that we own. It is somebody else's building. It is a prison building. But what we have to do is recognise that, well, how's that for prisoners? And as nurses and practitioners, I think we can provide really important services that are person-specific.
So are you reasonably optimistic given the progress that's been made, both of you, over the last few years?
I'm very optimistic. I think that offender health, better offender health, is the next frontier for those of us who are in the mental health and social care field. I think it is the next big area for improvement. Quite similar in some ways to the way that community care looked 10 years ago. We need to be intervening early. We need to be providing better support for people in the community through multi-agency services and alternatives to the institution, not imprisonment for people with mental health problems. And that is exactly the situation for community care 10 years ago. And it is the nursing role that's key to this. So I would go so far as to say it won't happen. Better mental health, the key to improving the mental health service of the next decade. It won't happen unless the nursing challenge is met. And that's to be able to provide mental health care in this unusual setting, to be able to combine the skills of mental health treatment with the skills of managing substance misuse and alcohol problems. It means being able to train other staff, because health staff in the end won't do everything in offender health. Some of it will still have to be done by prison staff. It's absolutely vital that the importance of offender health is recognised not just by the pioneers who want to work in that area, but by the organisations as a whole. That's absolutely key.
So if I can just, before we close, ask both of you to look forward 5 years. Callum, what would you think would be different in 5 years' time if the optimism that you've spoken about turns out to be realism?
Oh, what a good question. What a very good question. I would like to think in 5 years that there is a greater collective understanding, as Professor Appleby is saying, strategically, which is permeated down to practice, that the offender health the people who are going through offender health have more mainstream mental health care and acceptance from all of the services. We've kind of got a good start on prisons. In some areas, certainly at mine, in courts, we've got good services. We now need to move into custody suites to provide that same level of service. And if we could get to, as Bradley talked about, point of arrest with the police, even better.
And Lewis?
Well, I think the aspiration has to be, first of all, that nobody with a severe mental illness is in prison. And that means as soon as acute mental illness is found in prison, that there is a process to get them out. Or for that matter, that they don't get in the first place. So nobody with acute severe mental illness in a prison setting. The divide between substance misuse services and general mental health care to be gone. That divide which gets in the way of good, properly integrated clinical practice to be swept away by decent services. And I think the third thing is that people who are the best in the professions, the best nurses, want to move into offender health. In most parts of the health system, where you have the most difficult, intractable problems, that's where the best people go. Sometimes in mental health, that hasn't always been the case. People think about other sorts of specialty, but offender health is where the problems are most entrenched, where they have the greatest consequences for the individuals and for society at large, and that's where the best people should want to move. So we can get to the point where the best nurses are saying, offender health is where my career should go. That would be a fantastic achievement.
Professor Lewis Appleby and Callum Meiklejohn, thank you very much.